of the African Union. Cyril, you have the floor.
Thank you very much, President Kenyatta, Your Excellency, Your Excellencies, Heads of State and Government, Secretary General of the OACPS, His Excellency Mr. Georges Chikoti, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, colleagues and friends. I wish to express my appreciation to His Excellency President Kenyatta for convening this very important summit on an issue that is deeply affecting to each one of us. The coronavirus pandemic has clearly demonstrated that the nations of the world are profoundly interconnected and are also in many ways interdependent. As an organization that brings together countries from different parts of the globe, the OACPS has an important role in promoting cooperation and solidarity. And that is why we are rather grateful that this summit has been put together. As the countries of Africa, we have acted decisively and in unison to respond to the threat of COVID-19. Although the number of infections on our continent, Africa, is currently lower than elsewhere in the world, there is an expectation that the worst is still to come, with dire social and economic consequences. The outbreak of the virus has caused a great deal of damage to economies on the continent and is beginning to stretch public health systems in many countries. We have urgent needs as a continent with regard to medical supplies, testing equipment and facilities, laboratories, personal protection equipment, and equipment such as ventilators. At the same time, our experience in managing public health emergencies has served us well, and it has enabled the rapid deployment of trained and experienced community health workers to do screening and testing. The African Union has developed a strategy to address the challenge of COVID-19. Through the 5 regional coronavirus task forces we have established in all the 5 regions of our continent, we are working across the national borders to oversee screening, detection and diagnosis, infection control and clinical management of infected persons, and also to drive mass communication and community engagement. As part of our strategy, we've established an African COVID-19 Response Fund as a key intervention to mobilize and direct resources towards the continent's response to this challenge. COVID-19 is a global pandemic and requires cooperation as well as solidarity amongst the nations and the peoples of the world. The AU has been in the forefront of mobilizing international support for both a health response to the pandemic as well as a comprehensive economic stimulus package for Africa. As part of the economic stimulus, we've called for debt relief not only for African countries, but for many countries around the world that are indebted. We call on the OCPS to support the AU's call for a 2-year debt still and a plan for the restructuring of both private and bilateral debt. We further support the appeal of the International Monetary Fund for special drawing rights allocations to provide additional liquidity to countries that are in need. the World Health Organization has been instrumental in supporting national efforts to combat COVID-19. As African countries, we continue to reiterate our full support for the World Health Organization, as well as support for its Director General, Dr. Tedros Ghebreyesus. We fully support the initiative by the WHO, together with many governments, non-profit organizations, and industry leaders, to speed up the development and the production of vaccines, as well as therapeutics, and to ensure that they are distributed speedily and equitably across the globe. We believe that no country must be left behind. In this regard, we call on the lifting of sanctions against Sudan and Zimbabwe, and that they should be provided space as countries to devote their resources to fight against COVID-19. This is a public health emergency and it needs a global response. We therefore need to promote multilateralism as the most effective instrument to ensure that all countries, big and small, rich and poor, are accommodated and that their voices are also heard. Now, through a decisive, effective and collective response to this global crisis, we will not only be safeguarding the lives and health and well-being of our people, but we will also be proving the relevance and the value of bodies such as the Organization of African, Caribbean, and Pacific States. Global solidarity also demands that we should also stand as one against all forms of racism and intolerance. Through the chairperson of the African Union Commission, Mr. Musa Faki Mahamat, the AU has strongly condemned the murder of George Floyd in the United States of America and shares the anger of millions of people in the United States and across the world. As countries that have borne the brunt of racial discrimination and oppression over centuries, we need to work together to end the scourge of racial violence wherever it occurs in any country in the world. By working together, we can build a peaceful, just, healthy and prosperous global community. And this is what solidarity means. I thank you.